Good morning, everyone. My name is Gary Parker. I'm the Associate Dean for External Affairs at the Brown School at Washington University, where I have the great privilege of serving as the inaugural director of the Clark Fox Policy Institute. And my co-hostess today is Atia Thurman. She is
Good
the
morning.
Associate Director of the Institute and my partner in all things except marriage.
That's right.
although some people wonder from time to time, it's the healthiest work marriage that I've ever had in my career, and I'm so grateful for it. And welcome. This is a first of a series, Pulse on Policy series, that's going to be looking at child and family well-being, and we'll be having conversations with folks who are engaging in really amazing work in advancing and addressing the needs of kids in the region. And so we really wanted to kick this off with something special. So we asked Katie Rahn, who is the Executive Director of the SouthSide Early Childhood Center, to join us. She is so knowledgeable in all things ECE and policy. And I think, Katie, you even have a doctorate in education policy.
Dr. Rahn.
I do.
She's
Right.
she has got a few things under her belt and a couple of surprises. But Katie, as I was really thinking about, what was the first question that I wanted to ask you, and I put some long, hard thought into this. And we always going to ask the tough questions. So the first question is, what is Katie short for? Is it short for Catherine?
Yes, I go by Catherine in my other life. I'm Atherine, Catherine.
All right. Dr. Catherine Rahn is here with us today. And I want to thank you too for joining us. One of the reasons that Atia and I really wanted to bring you on is to talk about what's happening in the early childhood education system as a result of the pandemic. Because we know that a lot is happening in terms of access to providers, a lot is happening to providers, and we just want to have a better understanding of, from your perspective as a provider and as an incredible advocate and policy expert, what is happening to the system right now?
Yeah, and we're aware that the system was already in crisis across the entire United States. So what might be different? What might be better or worse?
And you have 2 minutes to answer the question.
I was going to say, okay. So, I think that, Atia, what you just said is exactly right. This is a broken system before this all started, pre-pandemic. We had been working for years and careers, people's whole lives on trying to system and make it better for early childhood providers, childcare providers. So, I think the first thing that happened is, and I'll speak of the St. Louis region, because I think, it's what's happening here is different than what's happening across the state also, which is important to note. Especially from when we start talking about it from a policy perspective, because a lot of times policies come out from the state level that are supposed to be one-sided, and especially in this situation, what St. Louis is experiencing is very, very different than other parts of the state. But with that said, I think what happened immediately is that we were left with very little information, first of all. When things started coming to light, and the first round of city and county orders were coming out, childcare was sort of left in the breeze. So it was very unclear whether we were supposed to be staying open or closed. We, as a program, chose to close. Everything else, I hate to say, but because of common sense and what was coming out and what was being said about the virus and how it spread and, risk factors, we chose to close. But it wasn't until, after that period that we were actually told for this people who are located in the city that we could serve just healthcare workers or first responders. Providers in St. Louis County were told they could also serve essential workers. So, you know, I think that there was a lot of shock and uncertainty. And I think for our field, there was a lack of infrastructure supporting communication and coordination prior to all of this. So we're getting, you know, there's very little information coming from any sort of, you know, centralized sources. I think that, you know, the other thing that started happening immediately is people started worrying about their livelihoods. As soon as the closure started happening and people are choosing to close in order to stay healthy and well, obviously their main income, which was for most programs is parent fees and childcare subsidy, that was not, you know, going to be coming in anymore. So, you know, people are starting to, you know, really panic about what was on the other side of this. And, you know, I think then as things progressed and we started, you know, more information, both locally and at the state level, you know, there were things that came out, you know, changes in how childcare subsidy is being paid, for example, which are good. I think, you know, that there's a lot of issues in terms of how the business model works for child. And I can go into that a little bit more, but I think that's at the heart of all of this, because an already fragile business model that relies heavily on, you know, what the market can bear, if you will, it's not going to survive.
Yeah. So the first thing was you received information that was there a mandate that providers needed to close that came out from, just trying to chronologically understand, you know, what it was like as a provider when all of this was unfolding?
Yeah, so we as a provider were following the guidance that was being given to the K-12 system. So
okay.
We did not have guidance for early childhood providers, you know, when this all started. So, you know, not to sound negative, but per usual, we were looking outside of our system for guidance and trying to, you know, piece together what we could in order to move forward safely. And I think, you know, that was really the worry for many folks, was there just was not a lot of information how to do that. And, you know, as information has become more available and as we're learning more, you know, we've come to understand the need for appropriate PPE. We've come to understand the importance of, you know, all of the different types of social distancing and health screenings. And, you know, all of that is really very difficult to do, if not impossible to do in an early childhood classroom. So information has become more available. You know, we've been working on putting together guidance based on what the CDC is putting out, DHSS is putting out, you know, the American Academy of Pediatrics. We're putting all of that together and actually releasing a guide to reopening, considerations for reopening. We're putting that out through our statewide partners today. But the biggest caveat is, you know, you have to assess your own risk level. And you have to ask yourself some questions about, you know, can you actually implement these guidelines? Do you know, things like if you actually follow the social distancing, the group sizes, we're required to have stable groups that don't, so you same group of kiddos with the same teachers throughout the day and moving forward, you know, sort of indefinitely. That needs to be the group size. It'll be half the normal size, if that, with the same number of teachers, if not more. So can you do that? Can you afford to do that? Can you have fewer kids and more teachers? Do you have space? Do you have enough space to actually have large enough rooms? Do you have open air? Do you have the ability to open windows and have air flowing through the program? I mean, at the most basic level, do you have the appropriate masks and sanitation supplies? These are things that, you know, people struggled with to have the resources to run a program before. they're all, you know, incredible added costs, and especially for the majority of providers in the St. Louis region are, you know, working in some of the hottest spots in terms of community spread. They're more vulnerable themselves. They fall into at-risk categories. They have chronic health conditions. They're over the age of 50, you know, they're working, and we're being asked to provide care for essential service workers and healthcare workers who are, you know, most likely to be exposed to the virus.
Katie, I have a confusing, yeah, and frustrating, it must be. So I have a question a little bit about the economic model that pre-COVID-19 and how the pandemic may change our economic model. From what I recall, quality early childhood care and education comes at a high price for lots of reasons, but our little people need a big investment.
Yes, they do.
And families can't shoulder that investment on their own. So we do have some models that include state subsidies or things like that. But those same models also don't fully support the financial needs to operate a high quality center or even a home-based center. So talk to me a little bit about the economic model we had before, and then how the pandemic's gonna create a greater financial strain, or, you know, what are our,
Yeah, I think, you know, when we talk about the early childhood finance model, if you will, prior to all of this, most programs are relying on a combination of parent fees, and if they serve families who fall into certain income category, childcare subsidy. Both of those things rely on attendance typically instead of enrollment. So they're very difficult to rely on. They're not predictable. And for most programs, they don't have the administrative capacity to really do the sort of budgeting, you know, revenue projections, modeling that you really need to do in order to understand if you have enough money to operate. Will you have enough money to hire and retain, train teachers to have really high quality folks in your classrooms over time? And, you know, just the management of the finances, HR, data analysis, all of those things, they are the furthest things down the list for most, you know, small, medium-sized providers, even larger providers in different contexts. It's incredibly difficult. So there's been some good things in light of all of this happening. Childcare subsidy has moved to pay on enrollment, but only till June is how we understand it now. So, I mean, that's great. That's a good, you know, response for right now, but that's something that we really need to be thinking about forever. I mean, paying providers based on enrollment would allow people to predict revenue over time, which is what you need to do in order to you know, move forward in terms of being more financially sustainable. I think the other thing is that we don't, you know, providers are, many providers are so passionate about what they're doing in the classroom, you know, and caring for the kids and caring for the families and doing that so well. And a lot of quality standards are wrapped up in those things, in that sort of program implementation piece. But there is not much focus on program administration, which is equally as important, but it has to be resourced. People can't afford to have these components of their program unless they are in a structure like ours, for example, where we are a nonprofit. We have multiple revenue streams, and one of those, a huge one, is philanthropic support, which we're so grateful for, but that is not a realistic model for most providers in the community. So I think, you know, the other, and not to go too far in the weeds, but the other thing that our subsidy rates have been based on is something called the market rate survey, which essentially, you know, it's to ask programs to self-report how much they're charging families. And that's what our subsidy reimbursement rates are based on, is these market rate surveys. I'm oversimplifying here, but I think it's important to understand that no provider charges families the true cost of care. It is so much more expensive. It costs so much more to have all of these components of high quality than what we could ever charge a family, an individual family. So when you report your market rate, it's not accurate to your cost of care, but then our reimbursement rates are reflective of that. So we have to move away from determining reimbursement rates on market rates. Does that make sense? That's very in the weeds.
No. It makes perfect sense. And I actually didn't know that until this very moment. So I appreciate you getting into the weeds. We got to pull those weeds out, so that flowers can grow.
Yeah.
So Katie, one of the things that, when we were chatting yesterday, that you brought up is that, the system right now has basically, for the most part, stopped because of the pandemic, with few exceptions. And we're going to need to rebuild that system when things start to get moving again. And it's unclear when that would actually be. But one of the things that you said that really stuck with me is like, we don't want to rebuild a dysfunctional ECE system. Can you talk a little bit more about that?
Absolutely. And I think, I don't want to sort of push aside the immediate needs right now, because there are programs who are open. There are programs who are planning to reopen, and they need support right now. So I don't want to push that aside in any way. And we are working just as hard on that sort of immediate response, making sure people have, PPE, that they're accessing resources, that they're able to, have the sanitation supplies and all of those things. So that is very much like on the right now list, but we have to continue looking at the long term, even the medium and the longer term, because an already struggling system that's basically, in some ways collapsing right now, when people go back to work, they're going to want, at the very basic level, they're going to want childcare and they're going to need it. And so we have to be thinking about, how do we actually get back to a place and reimagine, because it wasn't working before. It wasn't good for folks before. There's so many issues across the board, but then especially there are just so many inequities when it comes to our most vulnerable kids and families, our communities of color, our communities where children have experienced a lot of trauma, who are, struggling to have their basic needs on a regular basis pre-pandemic, and these programs and providers are going out every day doing the best they can with nothing. And this was before all of this. So we cannot build back up a system that leaves the majority of our childcare providers behind. It's just not going to work. And we hope that people are able to come, reopen and start serving kids and families again when it's safe to do so. But I think we really need to push for, number one, we need to maximize the public funding that is available right now. It has to be used more efficiently. Just some of the things that we've already discussed around how reimbursement rates are determined, how people are paid. It can't be this unpredictable, system where people don't know what's going to be coming into their bank account month to month. It's just not. No other business would ever operate like that. And then we need to increase public dollars. There has to be sustained public funding for early childhood. 0 to 5, we need it locally, we need it statewide, we need more of it federally. It's the only, it's one of the only things that we can do to really start moving forward. I think that we've already talked about, maximizing coordination, increasing coordination, letting providers lead these conversations about what they need and what their families need. This has not happened for so long. Providers are, very smart. They know what they need. They know what they want. They know how they can better serve their families. So many of them just don't have any resources to support that. I was in a conversation yesterday with a woman who has a program in North St. Louis, and she was talking about needing to, get communication out to her families who don't speak English as their first language. She was talking about, her desire to have everything in multiple languages, to do, to provide different types of supports for her immigrant and refugee families that she's serving. And basically, we had a conversation about, we've been able to do that over time. Southside serves a high population of immigrant and refugee families, but we've been able to do it and do it well because we've had philanthropic support. Wonderful foundations and individuals who have helped us with resources to do that work over a long period of time. It's ridiculous that you would only be able to do that if you have philanthropic dollars.
Yeah.
That is not okay.
Katie, we have a question from Allison who's saying, I'm hearing that some childcare centers will go under. Is there a sense of how many?
I don't think we know that yet. I think that, we knew in the St. Louis region, for example, we knew that there was already huge supply issues, especially for infants and toddlers, caring for infants and toddlers, and for those people who are serving families who would qualify for subsidies. We knew prior to the pandemic that we only had, less than half of families had access to care, subsidized care, who would qualify for it. We knew that only 19% had access to subsidized care that would also be considered high quality. That was pre-pandemic. So it's very difficult to know what's going to happen. I think, the other thing that is confusing right now at the state level is something we've been fighting for on the policy side of things for a very long time is increasing eligibility limits for families to have more families qualify for state subsidy. That has the state has temporarily increased eligibility rates through August, which is something that I would, normally say is a wonderful thing. But in a time where the supply of providers is going down so dramatically and should be on the safety side, it's a very strange time, at least in the St. Louis region, to increase eligibility. Fewer providers are available to serve those families. So, things like that, and the other parts of the state are different right now. So I'm just talking about the St. Louis region. But yeah, supply is a huge concern. It was a concern already. So time will tell. I think this is why we have to push so hard for these.
And I just want to add to that nationally, there's reports coming out of different places that are saying that we probably could lose about 49% of licensed childcare slots nationally. The National Association for the Education of the Young Child is doing nationwide surveys. Some of their data is supplying that information. What we've heard in Missouri statewide is Missouri could lose about half of its licensed childcare slots as a result of the pandemic and the economic repercussions. And I do find it just fascinating to think about losing slots, but as we restart the economy and first of all, we have the essential workers who are oftentimes, a large portion of our essential workers are women and minorities. They're also some of the lowest paid employees in the United States without safety net, without health care built into their, employee-sponsored health care and things like that. But then at the same time—
Childcare providers, right, Atia?
That's childcare providers who need to go take care of other people's children and can't afford childcare or high quality childcare and education for their own children oftentimes.
Or health insurance.
Or health insurance, right? Or any of right. And so then we have this mismatch, right? We already had, like you said, the supply was already not meeting the demand. And now we have an interesting shift in the dynamics with restarting the economy. Who goes back first? Who never left the job market because they were essential? Who can afford to stay? What childcare centers can afford to stay open? And who can afford to send their children there?
So, and Atia, I think that this is also who can afford to stay open, but right now it feels like the privilege is who can afford to be closed. The privilege is we can afford to be closed because we have a diverse enough set of revenue streams and operating reserves and philanthropic partners. We can put our health over our finances right now. And that's the real privilege right now in the short term.
Yeah, but even that will have limits. Katie. I mean, you won't be able to do that indefinitely. Eventually,
Right.
you know, if we don't find our way out of the other side of this pandemic, there's going to be some serious repercussions to all
Right.
ECE providers, regardless of whether they're center-based, school-based, church-based, home-based. I mean, one of the real strengths of the ECE system is that it has this mixed delivery system, and that there's no one way to get ECE. But that seems to also be the biggest weakness of this system. One of the biggest weaknesses in terms of being able to have access, but also those smaller providers are incredibly vulnerable right now.
They are the most vulnerable, and I think also they actually make the most sense in terms of health. You know, the smaller the group sizes, the more, you know, the less co-mixing of groups. Home-based care is actually ideal for this for right now, but we don't have a system and a structure that can match families with that type of care in an efficient way. And that's where centralized data systems and those of coordination, like this infrastructure piece that we were talking about pre-pandemic and are still talking about now, really need to be in place. They could be matching families to providers who are open and operating safely and want to be doing so. You know, and I think those are the programs though that just don't have typically have the sort of business management capacity to weather this storm. It's going to be incredibly difficult.
Our friend Krista is asking, how do we deal with state legislators who use the pandemic as an excuse to cut even further?
Yeah.
Well, I think I heard, I mean, I know you're also head a committee with Kids Win Missouri, and I don't know if you want to talk about that, but I every week I read their publications, and Kids Win Missouri was, you know, asked for urgent action back at the end of April, because the state passed a budget that included like $10 million cuts that would affect childcare funds.
Mm-hmm. Yeah, you know, I think that so how do we do it? I think is we stand up and express our, you know, we pay attention and we get involved and we express our needs and our wants as a system. And I think Kids Win has done a great job of helping us to put voice to that, providing, you know, wonderful action alerts that are going directly to legislators, and people are participating, which has been so amazing. And I think that, you know, number one, maybe we've all had a little bit of like a few extra moments in the day to take a breath and read email, which is not something childcare providers usually have. So, you know, I say that with so much love that it's very hard to be an active advocate in the field while you are spending your days caring for kids and families. But I think, you know, it is what we need to do. We need to put our voices together because individually they don't unfortunately get heard. But when we act together, the most recent action alert that went out, I think, you know, 500 legislators were contacted. You know, there was 500 contacts to legislators, and it made a difference. They you know, reversed the $10 million funding cut at least. We just have to keep at it. And I think it goes back to that, you know, what I was saying about some of the nuances that only, and Gary, I think this is part of your all's slogan at some point, but that idea of from policy to actual practice, there are so many disconnects in early childhood, between early childhood policy and what's actually happening within programs, and how centers are in homes, and, you know, people are experiencing how the impacts of these policies, that it takes us saying, wait, this does not make sense. This does not work. And we need people, you know, to come together and say that collectively, because otherwise, and this is why I got involved in advocacies, you know, in the first place, was, you know, I kept thinking, who made this decision? You know, who decided this? This does not make any sense. And I think that's what we have to continue doing, even though it adds to our plates. You know, it's just so important, because otherwise decisions get made that are actually harmful, especially right now.
Yeah.
Speaking of,
go ahead. Atia.
You're right. It's difficult and challenging to do both. Talk to me a little bit about one of the efforts that you had been a part of locally, First Step to Equity Collaborative, and a little bit about what that entails.
Sure. So we're still very active and pressing forward. So the First Step to Equity Collaborative is a group of folks who came together a few years ago and really focused on how do we make change? How do we reimagine this system and actually make it work for the people who, are living and breathing within it and most impacted by what's happening to it? We have a wonderful group of partners around the table, including the Clark Fox Policy Institute. Shout out. But, we're providers, we're organizers, we're, social justice folks. I mean, I won't name all the members of the collaborative, but, it's a really diverse group of people in terms of our backgrounds and what we might be, have more expertise in. And I think collectively, we went through this process, with one of our partners, WePower, to really, take all of the research that we had been working on for a few years prior to that around, everything we've been talking about, the issues with the system, the supply and demand, analysis, the gaps in terms of service and quality and all of that, and really move from just naming the problem to actually taking action. What are we going to do about this, instead of just, being a provider who sits and says, this system is broken, it doesn't work for me, it's not good, I don't like it. How can we actually move forward? Because that's how a lot of us have been feeling for a long time. So with WePower, we were able to take it to back to providers and parents and back to the communities that are struggling the most and have the least amount of access to resources and the least amount of access to quality supports, and say, what do you want to see happen? How do you want to see these recommendations move forward? So we went through this process where we had the solutions teams full of those community members actually designing solutions that led to the early childhood playbook, which included the sort of, marching orders for all of us to continue pushing forward in our region. And a big part of that is increasing, or actually creating, local dedicated public funding for early childhood. So we had just launched Ready by 5. The last weekend in February, actually, was the launch of our campaign, which was for St. Louis County, and would have generated through sales tax approximately $84 million a year for children 0 to 5 early childhood programs. So we were literally kicking off signature collection, and obviously we had to pause and reevaluate and figure out, what could we do? Could we continue moving forward? Do people even want us to continue moving forward in light of everything going on and everything that's happening, and potentially, what everything's going to look like economically moving forward? So we did a lot of surveying, a lot of conversation, a lot of work with the providers and the families and the community members who were involved in the solutions teams. And it was a resounding yes. We want you to push forward in any way possible. We know that this can't, just because this is happening right now, it's not changing the needs that existed before. It's only like exacerbating them. So yes, push forward. So now we have shifted to, we're going to be advocating for the county council to actually put the initiative on for vote in November still. So that's where we're at right now. Evaluating, is that possible right now? Obviously, there's a lot going on with county council members right now, so we're trying to be sensitive. But we know that this system, it was so fragile before. We have to push forward with these long-term sustainability goals if we're actually going to not just save it, but then sustain it.
Yeah, I think one of the things that we're most proud of when being a part of the First Steps to Equity Collaborative is that this has been a really community-driven effort for several years now, and that there has been a real desire to kind of understand the system as it exists, so that then it can be reimagined into something that works better and that's more equitable and has better access to quality. And so the report by IFF, which did a terrific job on understanding where the greatest need is for ECE services. And what that report demonstrated, which is no surprise, is that the areas that have that are highly impacted by poverty, and those areas that are predominantly have communities and families of color, have the least amount of access to quality, affordable ECE. And then there was that great report that came out from UMSL, which was a fiscal analysis, that said, we know that money's coming into the system. Where is that? What is that money, and where's it going to? And there was an analysis that looked at the federal, the state level, the local level, the philanthropic level, and then how much money parents were putting in. And the not so surprising finding out of that report is that parents are disproportionately bearing the burden of the cost of ECE. And then, of course, we have our own report here at the Clark Fox Policy Institute called Launching Lifelong Success, that just clearly documents the science behind, like, why is quality, affordable ECE so important to a child's development in terms of their health, in terms of their education, in terms of their financial vitality across a lifetime. And all of this information then was, really kind of assessed and grappled with through all of the solutions teams with We Power and their Tomorrow Builders Fellows, and came up with this terrific map on how do we rethink and redesign the ECE system. And then I also want to thank our folks at Skip Design, because they are also looking at when you start to work one piece of the ECE system, there are going to be intentional and unintentional consequences for those. And you want to just be aware of them so that you can adjust course as needed. And in a future conversation, and I hope our participants will come back, we have Saris Chung, who will be talking about some of the design modeling that they've done for that system. So out of that came this campaign, this Ready by 5 campaign on the county level. And I've heard there's something similar brewing on the city side.
The city has always been a question mark since we've been exploring the revenue streams and the viability and feasibility of the different public revenue streams. We found out pretty quickly that the sales tax was not going to be possible in the city for a lot of reasons, so we had to pivot. At sort of that same point, another one of our amazing community partners, the St. Louis Mental Health Board and their team, started talking to us about, what could they do? Is there anything that they could do to help push things forward in the city? So something we have been exploring and are currently exploring is actually increasing the levy in the city that funds the mental health board, the children's services fund in the city right now to its maximum level, which would be an increase of 6 cents essentially, and it would generate approximately $2.3 million a year that would be dedicated to early childhood programming in the city of St. Louis, which is actually really, it sounds disproportionate when you hear $84 million in the county and $2.3 million in the city. But I think as a collective, we all, recognize that we want something needs to happen in the city, and we can't not do anything. And we need to, even if it's not as large, relatively speaking, $2.3 million annually into the early childhood system is actually, really would be really amazing and impactful, and especially if maximized, and used, and allocated according to some of these strategies for the reimagined system, not the current or old system. So it's really promising. But again, because of the situation we're in now, it relies heavily on the Board of Aldermen putting the initiative on the ballot. So
if the Board of Aldermen and the County Council put the initiative on the ballot, then there is no need to collect signatures. You're able to bypass that process. And it was the signature collection that was stalling the campaign, because there's no place where large numbers of people are congregating to be able to have them sign on to support this ballot initiative.
Yeah, and you cannot do it electronically. And in Missouri. That's been something that some other states have pursued, but not something that was viable here.
Yeah.
So yeah, so we've had to really pivot and, be responsive to, the context that we're currently in. But again, I think from all of the folks who are at the table with us, helping to, lead and guide these decisions, it was, the feeling was a resounding, please don't stop. We know that this is needed. It's needed now. It'll be needed more than ever.
Yeah.
So as a collective, we're trying to just be as creative and nimble as possible. And of course, if, I'm optimistic, of course, always eternally an optimist, but I think, just know that this is a long-term game as well. So, whatever happens, this is what we need to continue to fight for.
Katie, could you tell us a little bit? So throughout the entire program, we've really talked about the fissures and cracks in the systems and the ways in which we can make the system whole and better and, just much better for our next generation. Can you talk a little bit about if we implement some of the recommendations from the playbook, from Launching Lifelong Success, from IFS report, what are the sort of like defining features of a new childcare, early childhood education system look like for the region?
I think sort of at the core to what the new system looks like is a strong and supported workforce. We know that is central to these outcomes that we're trying to achieve. The teachers and the caregivers and the administrators within these programs have to be supported. So we have to have a system that actually pays people, not just a above minimum wage, but a truly a sustaining wage. So many folks right now are paid minimum wage, hourly, no benefits. And so the turnover in the field is just, it's so high. And I think, a study I saw from, recently from Nebraska is like 36% is the turnover rate in programs. And I know it's higher in some, and lower in some, but it's very high. And this is what causes the, this revolving door of the workforce. It causes so much instability, and you cannot implement high quality curriculum, assessment, administrative practices if your team is constantly turning over. So, at the heart of a strong system is a strong and supported workforce, in my opinion. Well, there's lots of research to support that too. So I guess it's my opinion and there's research, but I think, so many of these things, we talk about the sort of the systemic layers, that need to be fixed around increasing and maximizing existing public funding and the way it's allocated. These are once those things are in place, then programs will actually have the revenue flowing in to pay their teachers and their staff what they should and deserve to be paid. You have to have that kind of revenue coming in, though, to sustain that, because you can't just have a one-time grant and give people raises and start paying benefits, and then if that grant goes away, you have no way to continue that. So it has to be sustained funding over time, which is what public dollars can provide. I think, so then once you have the ability to actually hire and retain your workforce, then you can really dig into some of the wonderful quality improvement and quality, maintenance strategies that I'm sure people have, there's so much technical assistance out there, so much support, but you have to have the people there, and who are present, who aren't, worrying about their own family's well-being, who aren't, worrying about how their basic needs are going to be met in order to actually have those sort of trainings and supports.
Yeah.
Does that make sense?
Absolutely.
It makes complete sense. I just want to let our attendees know we have time for just another couple of questions. But Katie, I want to ask you about, because we have this now city-county divide, and that you've reported that there are 2 campaigns and that there'll be 2 pools of funding. How do we ensure that when we're talking about an equitable ECE system, that there's some sort of coordination amongst the region? I'm softballing you a question here.
Yeah, I noticed. Yes, I think one of the the other key strategies that was identified and that we're still pursuing is the need for a regional coordinating entity. So something that was identified from the very beginning of all of this collective research and work, that it's just so difficult for providers to number one, it's a very difficult system to exist within, period. But then on the other, they're also just incredibly isolated. There's a lack of consistent, clear communication from all levels, and providers end up just leaning on each other for support, which is wonderful, but unfortunately sometimes when none of us have all of the information, it doesn't help us move forward. Mm-hmm. I think the other thing is that there's been because of how some of these systems are designed, and the way that funding is allocated, it just doesn't inherently support coordination. It actually fosters competition among providers who shouldn't feel like they're in competition with each other. So I think something that we identified really early on was the need for an entity that was truly led by and with providers and families at the table, identifying again what solutions and strategies need to be pushed forward, what policy levers need to be pressed upon, how do we make sure that resources are allocated equitably, knowing that we live in this system of city-county division. And we try, well, let me first say, we tried every way possible to try to have one campaign and one pool of funding that could be allocated regionally. And because of the way the systems are designed, they are designed that you cannot do that legally. So we probably looked at every single angle we possibly could to try to avoid having a city pool and a county pool. Unfortunately, right now we can't do that. So we think the next best solution is to have an entity that can help, really push for the resources to be allocated in alignment with these strategies that the community has determined are most equitable and most impactful.
Yeah. So in the interest of full transparency, I am co-chairing the search committee for the executive director of this new regional entity. And the good news is that there have been a series of anonymous donors who have committed to funding the first few years for this organization. So it is happening. The regional entity is happening. And that is a great news for kids across the St. Louis region.
And I think so in terms of, really making sure that all of this work, all of the research and the community conversation and the excitement and the engagement, we have more providers at the table right now than we have ever had, together, talking, planning, advocating with each other. All of that needs to continue. And we again, when we talk about what should be different about the system, so much of the, sort of advocacy that was happening, well, I wouldn't even say advocacy, a lot of the, community conversations with people who were not childcare providers, talking about things that should happen to childcare providers. And I think we've sort of flipped the script on that in some positive ways, so that as we come together and we think about how to organize ourselves and support each other, that's the voice that continues to lead.
Katie, we've talked a lot about financial models and structures. We've talked about the possibilities of center closures, but also the possibilities of funding mechanisms that will support a better childcare system. We've talked about supporting the workforce in the childcare sphere, and we've talked about regional entities that could really help us coordinate and be much more efficient. What does all this mean for children? And Gary can answer this too, right? We just rolled out launching lifelong success. So what does all this mean for the little people who are in our care all the time and the benefactors of these supports?
Well, I think it means the world to them. I mean, this is the difference. I mean, our kids, we know that kids who experience high quality early childhood supports and services are more likely to be ready for kindergarten, ready learners. They're more likely to be healthy. They're meeting their developmental milestones and getting their any sort of delays or disabilities addressed, and services and supports in place. This changes a child's whole trajectory for their life. And for those, I am a huge proponent of two-generation approaches. This is equally as important for the families of these young ones. Their stability, their ability to care for their kiddos and be the strongest and most stable parents and households they can be. This is what we need, this combined approach for our youngest kids and their families. I noticed some of the folks on the webinar today, are home visitors, people working in early intervention. When we talk about early childhood, we're talking about this comprehensive approach to the whole child and their whole family. And it takes all of these pieces: high quality early childhood programming, whether that's in a home or a center, whether it's through a home visiting model, that includes early intervention services when needed and necessary, family supports. This is life-changing. This will change a child and a family's whole life. So, it's absolutely critical. Now that I'm passionate about it. We have another hour and I'll keep talking.
Thank you so much.
And that shows. But I think you raise an incredibly important point, which is if we are going to come out the other end of this pandemic with a strong economy that has set up our children for success for generations to come, the foundation of that is not only providing the quality services so that children can have their, emotional and developmental needs met, but so that parents are able to re-engage in the workforce in a way that allows them a sense of relief that they know their children are safe, and that, any issue that arises, that they have very talented, committed ECE providers who are there to attend to that child. So Katie, thank you so much for everything that you do. I'm a huge Dr. Katie Rahn fan. and our collaborations with you have been, incredibly fulfilling and meaningful. And I'm grateful for your partnership and for your time today.
The feeling is completely mutual. I love you both. And I think, again, this is all of us coming together, all of our different worlds and our different areas of expertise is what's making these collaborations strong, meaningful, and our ability to move forward with each other is what has made it so fulfilling for me too. So thank you.
So Atia, do you want to tell folks about our next two webinars coming up and how they can sign up for those?
Right. So actually, let me type that into the chat, because we really would love for you to continue to join the conversations around family and child well-being in the wake of COVID-19. So we have a series that we launched today with Katie. Thank you so much. Gary, I'm going to look up our address and put it into the chat where you can learn more. We have at least 2 more sessions that are coming up. We're going to talk about family well-being through the lens of asset building and food security. We're going to talk about, it's amazing, the mind of Dr. Sarah Chung in our 3rd series around modeling and interventions and planning for unintended consequences and understanding the whole system. It's just going to be some great conversations. We really want you to join us. Bring your children. We know you're at home with them, most of you. Some of you are at work. but bring your coffee, bring your tea, bring your ideas and your questions and comments. It was a really rich discussion today. Relaxing, believe it or not, in the midst of what feels like chaos. It's so wonderful to have our friend and colleague, Katie Rahn, here and all of our community on the call today, just being part of these conversations. This is what does help move us into action and helps us to stay connected. And that's really critical during these times.
Great. Thank you. Thank you, Atia. Thank you, Katie. And thank you
you,
to all of our
guys.
attendees. We'll see you at the next one.